Hello and a very good afternoon, everyone. Welcome to a brand new episode of MasterSeries with our expert. We have a very important session planned today where we would talk about COVID-19, the current status of infection, vaccinations, and precautionary measures. This session is organized to commemorate the World Hand Washing Awareness Week. So we have two components of this session. The first component would be taken up by Dr. Rakesh Gupta, President and Director of Public Health, CIFER. Dr. Gupta has served as the Director of Health Services and the Director of Chemical Examiner Lab in Punjab as well. He has more than 35 years of professional experience and is a 2012 graduate of Johns Hopkins School of Public Health in Baltimore and a 2012 short-term scholar at the University of California, San Francisco. Dr. Gupta has made major contributions to numerous national and international conferences and has been awarded by the WHO on World No Tobacco Day 2015. So let us hear from him about the current status of COVID-19 infection. So welcome, sir.
So thank you, Darshika, for a very generous introduction. Today we'll be talking about the status of COVID vaccination in India. As we all know that the danger of third wave of COVID is looming large on India as well as whole of the world, in fact. So we'll be talking about what is the current status of COVID vaccination in India. So currently, about 50% of eligible adult population is fully vaccinated, and 85% of the eligible population of India that has been inoculated with the COVID vaccine first dose. And if we see the figure of today morning, so the 7th of December morning, it is 128 crore and 77 lakh at present. Next. So why is Omicron a COVID-19 variant of concern as it has been declared by WHO? So based on the evidence that it has several mutations that may have an impact on how it behaves. And if we just want to know how many cases are there for Omicron in India, so currently there are about 21 cases, and they are spread in Gujarat, Maharashtra, Delhi, Rajasthan, Karnataka. And if we because some people they want to know whether the Delta variant was more worse than Omicron, then we can say that confirmed cases of COVID-19 caused by Omicron have caused mild symptoms, and most of these people, they have been younger. Next. Next slide, please. So what is the emergency use authorization and the permission for restricted use? So emergency use authorization, it is a regulatory mechanism to allow the use of the vaccines and medicines to prevent and or to reduce the impact of the life-threatening diseases or conditions as caused by the COVID-19. So, but however, before the grant of the this authorization for emergency use, safety profile is always checked so that the vaccine or the medicine used is safe enough and it is the efficacy is good. So emergency use authorization by Indian regulators is aligned with the global guidelines. And currently we have 7 vaccines approved for use in India. And if I say the first 4 ones are the Covishield, the Covaxin, the Sputnik, and the Zycov-D. So these have already been available in India. And there are 3 more. Next. So as I told you, Covishield, Covaxin, they are already available. And the Covishield is actually approved in 47 countries. And the Covaxin is now approved in 12 countries. Next. So now we also have Johnson & Johnson, then Oxford. This is actually AstraZeneca. So this Johnson & Johnson is approved in 85 countries, and AstraZeneca, it is approved in 127 countries. Next. So Zydus Cadla that has now produced a Zycov D, and it is actually approved even for the kids below 18 years. So it is a DNA vaccine. And then we have Moderna vaccine, which is approved in 79 countries, and the Sputnik vaccine, which is approved in 74 countries. The Moderna vaccine, it is an RNA vaccine, and the Sputnik is a non-replicating viral vector. Next. So currently there are about 14 vaccines in clinical trials in India. So to summarize, these are NVX CoV 2373, then Covovax vaccine, then AKS 452, then Zycov D, Sputnik V, AZD 122, then Covishield vaccine, then Covaxin. Next, BCOV 2A, BCOV 2B, BCOV 2C, BCOV 2D, and HGC 019, BBV 154. These are currently under trial in India. Next. So this Covaxin vaccine, it is purely an indigenous vaccine, and the indigenous inactivated vaccine is developed and manufactured in Bharat Biotech's BSL-3, Biosafety Level 3, and it is high containment facility. And the vaccine is developed using whole viron, inactivated vero cell derived platform technology, and inactivated vaccines that do not replicate, and they are unlikely to revert and cause any pathological effects. So we can say that this indigenous vaccine produced in India, that is a very, very safe vaccine. Next. This Covishield is actually the AstraZeneca vaccine, which is available in many countries. And it is this vaccine, this is a recombinant replication deficiency chimpanzee adenovirus vector encoding the SARS or COVT spike glycoprotein produced in genetically modified human embryonic kidney. So this product that contains genetically modified organisms. So, and Covishield vaccine that is freely available in India, and most of us, we have received this Covishield vaccine, and it is available in many other countries, almost more than 70 countries. It is already available. Next. Then the Sputnik vaccine, it is adenoviral based two-part vaccine against the SARS-CoV-2 coronavirus. And Sputnik V uses a weakened virus to deliver small parts of the pathogen and stimulate an immune response. So the cells that will use the gene to produce the spike protein, and the person's immune system will treat this spike protein as foreign and produce natural defenses, or what are called antibodies and T cells against this protein. Next. The Zycov D, it is world's first COVID-19 DNA vaccine and developed in partnership with the DBT BIRAC under mission COVID Suraksha. The central government will receive the first batch of the Zydus Cadla's 3-dose coronavirus vaccine for people above 18 years of age, and most probably it will be available in this month itself. But instead of 2 doses, we have to have 3 doses. Johnson & Johnson COVID-19 vaccine, it is authorized by the US FDA for emergency use, and the first single shot vaccine in fight against this global epidemic. So the Zycov D, on one hand, it is 3 dose, and the Johnson & Johnson, it is a single dose vaccine. Then the Moderna vaccine. So it is manufacturer is Moderna RTX, and number of shots are 2 shots at 28 days apart. So moderately to severely immunocompromised people should get an additional primary shot, that is third dose, at least 28 days after their second shot. So in the case of Moderna also, if you are immunocompromised, you need to have a booster dose. Next. Then if you ask me, is the emergency use authorization a new process introduced for COVID-19 vaccine? Actually, the concept of EUA always existed to save the lives of people all over the world with vaccine and medicines for life-threatening diseases. So as of January 2021, 9 COVID-19 vaccines were in emergency use in numerous countries around the globe, and now there are many more. So both the Indian COVID-19 vaccines, they have completed their phase 1 and 2 trials. Covishield has completed its phase 3 trials in UK and the bridging trial in India as well. So what is phase 1, 2 and 3 clinical trial for a vaccine? So vaccine, it has got some the preclinical trials and the clinical trials. The preclinical trials are vaccine developed in the laboratory animals only. And the clinical trials are when actually the participants, they voluntarily participate in the clinical trials. So phase 1 clinical trial is assessing vaccine safety, immune response, and determining the right dosage. This is a short duration trial. Then the phase 2 clinical trial, in this few hundred participants, they are there, and it is also a short duration trial. The phase 3 trial, there are thousands of participants and the duration is 1 to 2 years. So you see, there are various stages through which the trials are done for vaccine approval before the vaccine is approved. Next. So since we all know that the children, they are not being given the vaccine presently in India. So COVID-19, it actually affects all the age groups. However, morbidity and mortality is several times higher in adults, particularly in those above the age of 50 years, especially if they have some comorbidity along with. So children have either asymptomatic infection or the infection is very mild. So in the first phase, so the government of India has not taken up vaccination of the kids below 18 years. And there are some clinical trials now underway to test the effectiveness and safety of the COVID-19 vaccines in children. And as I told you that Zydus Cadila vaccine is now being made available very soon. So it is safe for kids also. Then Covishield vaccine manufactured by the Serum Institute of India. It is a viral vector-based technology, and it is already been used for Ebola vaccine. And the Covaxin vaccine, which is manufactured by the Bharat Biotech, it is a whole viron inactivated coronavirus vaccine, and it has already been used for influenza, rabies, hepatitis A. The same technology has been used. Next. So in Covishield, there are inactivated adenovirus with segments of coronavirus and aluminum hydroxide gel. And in Covaxin, there is inactivated coronavirus along with aluminum hydroxide gel. And both actually vaccines, they required cold chain temperature. So plus 22, plus 8 degrees Celsius is required. And the cold chain for both vaccines is maintained through active and passive cold chain equipment, which is available in most parts of the India. And we have about 29,000 cold chain points across India. So there's no issue of maintaining cold chain in India. Next. So if because some people they have in mind that whether Covishield available in India and AstraZeneca, they are different. No, they are not different. They are the same vaccines. And the dosage schedule for Covishield vaccine has been extended in India from 4 to 8 weeks to 12 to 16 weeks. And the second dose of Covaxin can be taken 4 to 6 weeks after the first. So initially, as you know that for Covishield also we used to take the second dose after 4 weeks, but now it is 12 to 16 weeks. And in present situation in India, we don't have a option available. So whatever vaccine is available in the government facilities, if we have to take free vaccine, then whatever vaccine is available, we have to take that. We don't have a choice. Next. So normally, actually, vaccine development that takes years. So you know the earlier vaccines like for polio, then smallpox, it took years to develop. But in this case, Scientists, they have worked round the clock in the laboratory. Even regulatory approvals, which used to take several months, have been fast-tracked by Government of India. And it helped eliminate all the time lapses between the preclinical and the clinical trial stages. And earlier, the vaccine developed involved a series of steps, but in the case of coronavirus vaccine, the scientists and regulators, they worked in tandem, accelerating the whole process without compromises on any protocols and any step. So we have a very safe procedure for development and approval of vaccines in India, though we may think that it is too fast track. But the only thing is the red tapeism has been decreased for this vaccine. So that is the reason that India could develop two vaccines in very short time. And is it mandatory to take the vaccine? Yes. It is voluntary actually. But however, it is advisable to receive the complete schedule of COVID-19 vaccine for protecting oneself against the disease and also to limit the spread of the disease. So though it is voluntary, but I think all of us must go in for the complete dose of the vaccination. Next. So will the vaccine be safe if it is being tested and introduced in a short span of time? So actually, though the vaccines, they have been approved very hurriedly, but we can be rest assured that the regulatory bodies, they clear it based on its safety and the efficacy. And out of the multiple vaccines available, so how can we choose the vaccines which is chosen for the administration? The safety and the efficacy data from the clinical trials of the vaccine candidates, they are examined by the drug regulator of a country before granting the license for the same. So different COVID-19 vaccines, they are not interchangeable. So it is not that first dose you have taken Covishield and then you take Covaxin. It is not possible. So we should take the second dose, the same vaccine we should take. And will the vaccine introduced in India be as effective as the ones introduced in other countries? Yes. So our vaccines, our indigenous vaccines, they are as good as any vaccine which has been introduced anywhere in the world. Next. So the Indian regulators have given authorization to Covaxin. So even before its phase 3 trial, results were out. So how can we explain this? So we are passing through COVID-19 pandemic, and COVID-19 has caused social disruption, economic downturn, and significant number of deaths. To control this epidemic, the society as well as the system may have to take steps, which may also be termed as drastic. So both clinical and clinical trials of Covaxin have been thoroughly scrutinized by the regulators. So we should not have any doubt on the safety of the vaccine. So though the phase 3 trials were not over, but it has been approved and the regulators have allowed its use in trial mode. So next. So is it necessary for a COVID-19 recovered person to take the vaccine? And if someone has COVID-19 infection and was treated, and why should he receive the vaccine? This is in minds of people who have recovered from the COVID-19. But it is advisable to receive complete schedule of COVID-19 vaccine, irrespective of the past history of the infection with COVID-19. This will help in developing a very strong immune response against the disease. But in this case, we must wait for 4 to 8 weeks after the recovery from the COVID symptoms before getting the vaccine. And if we tell about the contraindications, so persons with history of anaphylactic or allergic reaction, immediate or delayed onset anaphylaxis or allergic reaction to vaccines or injectable therapy, they should avoid it. Next. So in the pregnancy and lactation, actually earlier the clear-cut instructions were that the lactating mother should not get it. But the current guidelines of the Indian government, they state that COVID-19 vaccination is recommended for all lactating women. So the provisional and the temporary contraindications are having active symptoms of SARS-CoV infection, as told earlier, and SARS-CoV patients who have been given anti-SARS-CoV monoclonal antibodies or convalescent plasma, they should avoid. Acutely unwell and hospitalized patient, they should also avoid. So these are the provisional or the temporary contraindications. So when you have infection, so when you have taken monoclonal antibodies or plasma, or when you are acutely unwell and hospitalized, then we must avoid for some time. Next. The health ministry has advised caution in vaccinated persons with history of the bleeding or coagulation disorders. So what tests can be conducted? There are few bleeding disorders like hemophilia. These persons should take the vaccine under the supervision of their treating physicians. And several people with heart and brain disorders, they are on blood thinners like aspirin and antiplatelet drugs. They can continue with the medicine and simultaneously have vaccine. So there's no issue with that. So the health advisory also states that those with immunity issues should be cautious about taking the vaccine. So immune issues, they are of two types: immunosuppression due to disease like AIDS, and people on immunosuppressant drugs like anti-cancer drugs, steroids, etc. So second, immunodeficiency in people who suffer from some defect in the body's protective system, such as congenital immunodeficiency. So either it can be due to the drugs, it can be due to the diseases, or it may be a congenital immunodeficiency. Next. So currently available COVID-19 vaccines that do not have any live virus, and therefore individuals with immune issues can have the vaccine very safely, but the vaccine may not be as effective as them. So in case of the immunosuppressed patients, whether it is congenital immunosuppression or due to drugs or vaccines, due to drugs or diseases, so we can take these vaccines safely, but so efficacy is a little less than normal individuals. So are there any preventive measures and precautions that one needs to follow at the session site? So there are the usual precautions we take for the COVID, like wearing of the mask, maintaining hand sanitization, and the physical distancing. So these are the only precautions we need to take when we are at the session site. So next. So what does the trial mode mean for a vaccine recipient? So the way we do in a clinical trial is first the recipient will be asked to give a written consent, and additionally the recipient will be followed up actively to see if the vaccine has led to any side effects. In short, it will be an extension of the phase 3 trial. So nothing to worry about, but the only thing is we need to be cautious about the side effects. And what is the safety and efficacy of the vaccines used in country? The vaccine developers, they have not reduced the sample size at any stage of clinical trials. Rather, it was bigger than we usually test a vaccine on. So this safety and efficacy is not an issue for vaccines we are being given in India. And when a vaccine is tested, most of the adverse events or the unwanted effects, if any, occur in the first 4 to 6 weeks of administration. So normally the side effects they occur within 1 month or 1.5 months. Next. So in order to ensure that it is safe, we keep a very close watch for the first 2-3 months on the people it has been given to. So this data also helps us in decide about the safety of the vaccine. So as far as the efficacy of the vaccine, we need time to tell how effective a vaccine is. All the global agencies, they have set the benchmark that only those vaccine candidates which show an efficacy of 50 to 60% will be considered. So all vaccines which have been approved till date, so they are at least they have efficacy of 50 to 60%. The trial follow-up continues for 1 to 2 years to assess the total duration of protection the vaccine will provide. So we actually don't know how what is the duration of the efficacy of the vaccine. it provides. So till date, we don't know about it. Next. So sometimes we have in mind that whether Covishield or Covaxin is better, but I must assure you that both would work fine in preventing the infection as well as prevent a person from going into severe state of the disease. As a long-term effect, it would be preventing death for the elderly or those who have comorbidities. So in any case, we must take vaccine because the severity of the disease is reduced and we will not be going to the IUC. Um, uh, so that is very important. And chronic diseases and morbidities like the cardiac, neurological, pulmonary, metabolic, renal, malignancy, etc., they are not contraindicated. Okay. Next. So all these conditions, if the patient has some comorbidity, still they must have the vaccines. So if one is taking medicines for illness like cancer, diabetes, hypertension, etc., so can that patient take COVID vaccine? So yes, persons with one or more of these comorbid conditions, they are considered among the high risk category, and they need to actually get COVID-19 vaccine so that the severity of the disease is decreased. And how long I will remain protected after vaccination, as I told you earlier. So yet we don't know the duration for which the protection lasts. Next. Next slide, please. And does this vaccine protect against newer strains or the mutated virus? The body responds to vaccination by making more than one type of antibodies to the virus, parts including spike protein. Therefore, all vaccines they are expected to provide reasonable amount of protection against all the mutated virus, including the latest one. And based on the available data, the mutations, as reportedly, are unlikely to make the vaccine ineffective. So we should not have any doubt that whether, because the mutants are appearing very frequently, so we should not take vaccine because vaccines that takes care of all the newer strains of the mutated virus. And in how many days will the vaccination create an adequate immune response and protection? So adequate immune response takes 2 to 3 weeks after completion of the entire vaccination schedule. That is after the second dose of any vaccine, um, like Covishield and the Covaxin. But in some cases, like Moderna vaccine, we need to have 3 doses. And after that, 2 to 3 weeks, that is the immune, and it takes about 2 to 3 weeks after the third dose in case of the Moderna vaccine. And should you avoid alcohol after receiving the COVID-19 vaccine? Till date, actually, there is no evidence of alcohol impairing the effectiveness of the vaccine. So it is not a contraindication that if you have taken alcohol, you should not take COVID-19 vaccine. Next. So is it important for me to receive the same vaccine during the second dose? I've already told you that till now it is a precedence that, and it is also indicated that the second dose of the same vaccine should be taken as the first dose. The COVID portal is also going to help to ensure that everyone receives the same vaccine. So there won't be any, I mean, problem with the different vaccine being given to the same person. So does the vaccine that provide herd immunity, when an increasing number of people they get vaccinated in the community, indirect protection through herd immunity that develops, and the proportion of the population that must be vaccinated against COVID-19 to begin inducing herd immunity is actually not known. But since we are sure that if maximum people they get vaccinated, we will have herd immunity. So it is good to stop this third wave. So thank you, viewers. And I hope this will prove to be useful for you, for doctors, and as well as general population. So thank you.
Thank you so much, sir, for this lovely presentation. Do you have any takeaway home message for our audience, clinicians who are watching you live?
Yeah, I think the clinicians, they must allay the fear of for general public. So whether to take vaccine or not to take vaccine, and they must insist that the population, the whole population, that is given complete dose, complete at least 2 doses of the vaccine, because currently, actually, the COVID and that Covishield and the Covaxin vaccines are available for government supply. So 2 doses should be taken. And luckily for us, that 50% of the population is almost now covered with the 2 doses, and that is very good for herd immunity.
That was a great lecture by Dr. Gupta. In our second segment, we will have Dr. Sonu Goel, Professor of Community Medicine at PGIMER Chandigarh. Dr. Goel has over 18 years of experience in public health and has authored over 100 papers, 35 chapters, and 12 films on national health programs and several public health books. Dr. Goel is also a visiting faculty at the International South Asian Union course on operational research for around 9 years. He shall be talking to us about the importance of hand washing and a special focus during COVID-19. So over to you, sir.
Hello, everyone. I am Dr. Sonu Goel, working as professor in Department of Community Medicine and School of Public Health, a postgraduate institute of medical education and research. So today I'll be speaking on importance of hand washing, especially in the context of COVID-19. So most of us, the clinicians who are listening to this talk, might be aware about hand washing. But many of you might not be knowing about the correct method of hand washing, the correct techniques of hand washing, and why this hand washing is really important, especially in this COVID-19 year. So if we, the thing which we know about hand washing is we wash the hands with soap and water. But for how much time we should wash our hands? We should wash our hands for at least 20 seconds. And drying of hands is a very integral component of hand washing, because if you wash the hands with soap, water, and if you don't dry those hands, so again, we are incomplete in our hand washing or hand hygiene practices. Now, why people say that 20 seconds is really important? Why not 25 seconds? Why not like 10 seconds, 5 seconds? So 20 seconds, it has been seen that if you wash the hand thoroughly, all the 6 steps of washing the hands is being done for 20 seconds, it removes almost 97% of the bacteria which is present on our hands. And that is really important, because if you wash lesser period of time and if you don't take soap, so the chances of remaining bacteria in your hands remains quite high, even viruses remains quite high. Now people say that you just sanitize the hands rather than hand washing. So I must reiterate in this talk that hand sanitization is not as perfect as hand washing. Hand sanitization cannot replace hand washing, especially in the context when our hands are muddy, when the hands are not very clean. And if you are using the hand sanitizer, it should be at least 60%. That is 60% alcohol in water. So just see in the hand sanitizer whether it is really the 60% is there or not. Otherwise, it is not adequate to remove many viruses and many bacteria, including COVID-19. Now, this is about hand washing. The steps of hand washing, many of you might be knowing about, but I'll just reiterate here the 6 steps of hand washing, which is very important. The first step is you should rub the hands from the front. Like you should rub the hands from the front, which normally everybody does. Then back of the hands should be rubbed. this way. Then in between the fingers, that people rarely do, in between the fingers. Then fourth is thumb. Both the thumbs like this, both the thumbs should be rubbed individually. Fifth is you should clean your nails. So this nail should be cleaned like this. And sixth is like you should clean your wrists this way. So these are the 6 steps which you should do, and then only we can consider this as a perfect or regular hand washing. People miss normally these steps, and for which the common bacterial sites, common sites where bacteria are lodged or viruses are lodged, are in this interweb spaces, which is here between fingers, this, and in the nails, which we normally miss. So this is the importance and the steps of hand washing. And everybody of you know that it is all types of infectious disease. COVID-19 is just one of them, like diarrhea, influenza, coronavirus. All type of diseases can be eliminated by if you do the hand washing. And it has been told that hand washing is one of the best practices, or even the most common and most cost-effective best practice for removing all those bacteria and viruses. And it has been said that, and it has been documented that around 50% of diarrheal episode and 50% of acute respiratory infection episodes can be prevented if we do proper hand washing. And that cost to be quite huge. So that is the importance of hand washing. Some of you might not be knowing about how this hand washing practice has been, how it came into practice. So there were 2 people. One was Ignaz Seminivilis. So he was a physician actually. And second was, I think many of you might be knowing about Florence Nightingale. So she was the father of modern nursing. So these 2 people were the people who have actually started this importance of hand washing. Because at particular time of birth, normally in the old era, it has been around 100 years back, when the mothers were giving birth to children. So what doctors, the same doctor who is practicing like after you do cremation, or after you do that autopsy, the same doctor was coming to actually deliver the birth. So what is happening? The infection which is there from the corpse or from the dead body is being transmitted to the mother or the child during birth. And because of this, there is a huge infections among those newborn babies as well as the mothers. So it was these 2 people who actually discovered that it is not due to the smell of that dead body, but it is due to the infection which is being transmitted by hands from the corpse to the mother, delivery mother. So there the problem, there this hand washing things have emerged. Now about COVID now. Now everybody now knows that COVID appropriate behaviors. So one of the behavior which was there about hand washing, proper hand washing, but other behaviors are wearing masks and proper social distancing and having the vaccine. I think in the previous lecture, Dr. Rakesh Gupta has told about the importance of vaccine in preventing COVID-19. So similarly, COVID-19 virus is no different from other viruses in the fact that it cannot be eliminated or it cannot be removed by hand washing. Can be very much removed by hand washing. So before that, I just want to tell you about the importance of hands, because what happens normally, we have a habit of touching hands to the faces, to the nostrils, to the mouth. So we always tell to the patients, to the attendants, that never touch when you are there. So never touch your face with your hands. And if you have a habit of frequently touching your face, you should do frequent hand washing. But now I must say that some people keep on washing hands every day, but that's also not good because that becomes the rough hands. So hand washing should be practiced after you in the morning when you wake up, after you do your daily practices, and then before eating food. That is really important because your hand is transferring the food to your mouth, and like you are playing somewhere, or you are touching the newborn, or you are touching a baby. So before that, one should always practice hand washing. And especially in the COVID, when when there is a coughing or sneezing, because at that point of time, uh, it is more likely that the infection through sputum is being transmitted to your hands, and that if that hand is touched somewhere, so it can other person can get the infection from there. So summarily, just want to tell you about that hand washing is one of the best practice which is being invented. Although we think that just washing hands with soap and leather will not do much, we should use a best quality sanitizer. But I must reiterate here that the best quality sanitizer, even that, cannot replace a proper hand washing. This is number one. Number two message which I want to give is hand washing not only prevent you from COVID-19, but many other infections, be it influenza, be it common cold, which is very common, diarrhea, which is very common. So these type of infection, it prevents. And third thing which I want to tell you about, people usually wash hand like this. They just even don't spend 5 seconds in hand washing. So you should make a habit. It's a sort of habit that spend at least 20 minutes, take liberal amount of soap and water, and then do hand washing. And fourth thing is that you should spread this message, because as a physicians, as a clinicians, it is our duty to tell to our patients for practicing hand washing. Make a point whenever you are delivering a message to your patients. So always practice this habit of telling them about the proper techniques of hand washing if you have time. So I finished my presentation here, and I'm open to any questions or comments from your end. Thank you. At the end, I wish to thank Doc Plexus for organizing this very important webinar on hand washing and the importance of vaccines in COVID-19 era, because these are the two things besides, as I told, the mask and the social distancing, which are really important if we want to eliminate this COVID-19 infection. So many thanks to Doc Plexus and all the people, all the clinicians, my colleagues who are listening to this talk. Thank you very much.
Thank you so much, Dr. Goel. So this brings us to the last segment of the session. We will now take up some questions from Dr. Goel. So my first question for you, sir, is how crucial is it to have clean hands when it comes to patient safety?
Yes, I think not only for the patient, but also the attendant safety, the hand washing is really important, and clean hands are really important, because hands are the most common medium through which we can transmit the infections. As I told, that we have a habit of touching hands to nose, to mouth, to our face, which is very delicate. So if our hands are not clean, if they are infected with viruses, bacteria, so then the safety of the patient as well as their attendants are compromised. So it's very, very important. And as I told, that 50% of the diarrheal disease and the acute respiratory infection disease can be prevented if we do proper hand washing.
Thank you, sir. My next question for you is why, despite all the efforts made in recent decades, is hand hygiene compliance still low?
Yeah, that's a misfortune that despite all the efforts, because there are 2 or 3 reasons behind it. Number one, as a physicians, we always think that the people might be knowing about hand washing. But actually, the studies have pointed out that even the doctors are not aware about the proper technique of hand washing. So patients and the attendants or the general public are not aware about the importance of hand washing. So that is one of the reasons why the hand hygiene compliance is still low. Second is the general public take the things very lightly. If you tell them about a sanitizer, they will purchase a sanitizer. But if you tell them about washing it by soap and water, they will think that it doesn't have much meaning. So always in your clinics, have the posters of hand washing, all the 6 steps which I told you, and that is bound to increase the hand hygiene practices among the patients.
Thank you, sir. My next question is it truly necessary to wash hands for 20 seconds?
Yes, it is necessary to wash hands for at least for 20 seconds. As I told that 97% of the bacteria and viruses can be prevented if we wash the hands for at least 20 seconds. And it keeps on decreasing, like the number of bacteria remaining on the hands keeps on increasing if we have the washing for 5 minutes, 5 seconds, 10 seconds. So 20 seconds is a very optimal time.
Sir, there's always this famous comparison, hand sanitizers versus hand washing. So which one, according to you, is better and in what circumstances?
Hand washing is definitely better than hand sanitizer. But if you don't have an option of doing hand washing, then we should do hand sanitizer. And again, 60% of the alcohol sanitizer should be there with you.
Thank you, sir. One last question. What distinguishes hand sanitizers from hand washing in terms of its efficacy?
I think it's the same question that hand sanitizers are important in the sense that it contains alcohol to that extent that it kills the viruses, most common viruses and bacteria. But hand washing removes everything if you do it properly. So, but some people say that first they do hand washing and then they do hand sanitizer. It's not needed. If you do proper hand washing, then hand sanitizers are not needed at all.
Thank you so much, Dr. Goel. These are all the questions we had. Thank you so much, Dr. Rakesh Gupta and Dr. Goel, for educating our doctors and highlighting the latest developments in the field of COVID-19 infections and necessary precautions to be taken. Dear audience, thank you so much for your loyal viewership. Do write to us if you have any questions or feedbacks for us. Please take care and have a great evening ahead. Thank you so much.